Hello and welcome to Global Health TV. This is the latest in our series of interviews looking ahead to 2011. I'm delighted to be joined by Professor Peter Piot, who is the Director of the London School of Hygiene and Tropical Medicine. Thanks for joining us.
Thank you.
Now, you've been in the job since the middle of last year. How are things going for you?
Well, it's absolutely a wonderful place with great staff, both researchers and educators, people who are very committed to the mission of global health, wonderful students, and so I'm very happy and still learning.
Now, one of the big issues on the table are the Millennium Development Goals. How far are we away from meeting them?
Depends where we are. Some countries are really going to meet the Millennium Development Goals, which like Brazil or many of the Asian countries. And so I'm quite optimistic. My biggest concern are countries in conflict, particularly in Africa, who will probably not meet the goals. And then there are some goals like maternal mortality, where we're also lagging behind. The key question is going to be the many health problems that are not in the Millennium Development Goals, and we should follow them as well and do something about them.
Okay, and what other big issues are there on the agenda in 2011?
Well, I see three things. One is that very concerned about funding for global health and for health in low and middle income countries with the financial crisis in the West, but not in Asia. So there are countries that can pay for it. The fact that recently there was so much attention about alleged corruption in the Global Fund, whereas actually the Global Fund is probably the most transparent of all the development agencies and is now taking measures to make sure there is even less misuse of funds. Secondly, there is a real tsunami of non-communicable diseases happening in the world. Diabetes, cardiovascular disease, mental health problems, and these are not being taken seriously and not being addressed. And so it's really great news that in September there will be a high-level session of the UN General Assembly to bring that issue at the top political level. And then a third issue is that it's 30 years since the discovery of AIDS in 1981. And that's a moment, I think, to take a cold and hard look and see what have we achieved, but also that realizing that we're going to have to live with HIV for a long time, and we need to resolutely move into long-term strategies there.
Now, you mentioned there the scandal with the Global Fund, and that has meant that money and aid money has been scarce. What are the challenges and possibly opportunities that have come from that?
It's essential that we make good use of every penny of international development. It's after all about the survival of people. The Global Fund has saved millions of lives, and the better we can do with existing funding, the better also we will be able to say development funding is a good investment.
And just finally, looking at your own organisation, what does 2011 hold for the London School of Hygiene and Tropical Medicine?
Well, for us it's always in the first place about excellence, top quality in teaching, top quality in research, and I think we're doing very well by any standard. And secondly is also to think through, in our globalizing world, solutions are being developed, particularly in middle-income countries, but also in Asia, but also in Africa. And what is our place in that world? How do we develop strategic alliances with institutions in Africa, in Asia, in the Middle East, in Latin America?
Peter Piot, it's been a pleasure speaking to you. Thank you.
Thank you.